I've been performing bariatric surgery now for 15 years, and I think more importantly, I've been performing bariatric surgery for the last 15 years with the same team members. We've got Michelle, dietitian, Michelle, psychologist, and Shirley, my wife, who's the coordinator. We all believe that an integrated team approach to bariatric surgery is essential for long-term outcomes. There was a publication from France some years ago looking at all the bariatric units in France, and the conclusion of that study was that the difference in outcomes was not related to what happened in the operating theatre. It was all to do with patient education and support afterwards. The advantage of having dietitian and psychologists who have 15 years of experience dealing with all aspects of bariatric surgery, I think, and weight loss is immeasurable. Obviously, the advantage for a patient's point of view is you don't have to go and look for a dietitian, and particularly often some dietitians have very limited experience of bariatric surgery and the complications or potential issues of bariatric surgery, and certainly some of the new procedures that I'm performing they may never have heard of. So there's an advantage in going to an experienced bariatric dietitian. Michelle and Michelle work very closely together in terms of long-term weight maintenance and avoiding weight gain and getting back on track. So Michelle, our dietitian, has particular interest in that. We meet regularly as a team to discuss patients who we have concerns with in terms of how they're doing, any issues they might have. It's also very easy because I'm in the same rooms. Both Michelle and Michelle can duck in and see me to talk about someone who maybe they've seen or had a phone call from, or if you happen to be having your appointment with either of them and they feel that you need to see me, it's very easy for them just to come and talk to me and we can slot you in to be seen that day. From a point of view of cost, we would encourage all of our patients to explore Medicare plans with their GP. That is in the hands of the GP, and some GPs are more helpful than others, but certainly if your GP is happy to do a Medicare plan and they do get paid for doing Medicare plans, then that opens up the opportunity of additional appointments at a reduced cost. In terms of talking about costs, obviously it's beneficial if you have health fund cover for bariatric surgery. Unfortunately, a lot of the health funds have made bariatric surgery a gold level requirement, so they have made it more difficult to get private healthcare for bariatrics. The advantage from my point of view is not so much in the initial surgical procedure. The issue is if you have a problem afterwards, if you've got a bit of nausea or vomiting, if you develop a bit of a stricture at one of the joints. If you've got private health cover, it's very easy for me to get you into a private hospital and deal with it in a matter of a day or two. If you don't have private health cover and you're self-funding, obviously we give you costings in advance for the procedure, and we very rarely have any issues with the initial procedure. But if you have a problem down the track, then your only option is either you have to fund and readmission to a private hospital. So it is still a worthwhile investment in the long term, even if you have to fund it all yourself. If you want to know more about costings and options for bariatric surgery, feel free to contact our reception staff, who'd be more than happy to give you some additional information.